Hello everyone, welcome back to another video. My name is Saurabh Pawar. Today video topic is about blood fluids and their significance for the diagnosis. Body fluids. Blood and lymph are the two most important body fluids in the human body. Blood comprises plasma, white blood cells, red blood cells, and platelets. Lymph is a colorless fluid that circulates inside the lymphatic vessels. The body fluids are circulation of these body fluids are described below in complete details. The types of body fluids. The different types of body fluids includes blood. The main component of blood includes plasma. Plasma is a liquid component of blood. It is thick fluid which makes 55% of total blood volume, with the rest of the volume made by blood components such as RBC, WBC and platelets. Plasma is 91% of water and the rest of the total volume is made up of dissolved ions, suspended proteins, dissolved gases, nutrient molecules and waste product. Albumin is the major protein in plasma. Other protein includes immunoglobulins and clotting factors. The red blood cells 40% of blood contains red blood cells. RBCs contains protein hemoglobin that gives the red color to the blood. White blood cells. The white blood cells are very few in number. The WBC to RBC ratio is 1:600. They mainly protect the body against the infections. Many WBCs cross the walls of the vessels and penetrate other tissues. Platelets are fewer in number than the red blood cells. That platelets help in the clotting of blood and the site of wound. Lymph. Lymph is a colorless fluid present in intestinal tissues. It circulates throughout the lymphatic system. It can be defined as without RBCs, the exchange of nutrients, hormones and gases occurs through the fluid. It consists of lymphocytes that play a major function in immune response of the body. The composition of body fluids are The composition of body fluids is explained below. Body fluids intercellular body fluids 70% of water, ions and molecule. The extracellular body fluid, cation, anions, transcellular fluid, electrolytes such as sodium, potassium, saliva. Saliva is the body fluid mainly composed of water. Eventually, the minerals and proteins present in saliva fluid protect you from tooth decay and gum diseases. Also, it allows you to chew and swallow adequately. Semen containing sperm, proteins, fructose and catecholamines are substances released from the man's penis ejection. Vaginal fluids. Vaginal types of fluids expels from vagina. It contains amino acid, proteins, carbohydrates and other acids obtained by lactobacillus bacteria. Urine consists of 95% of water which expels dead body blood cells and chemicals present inside the body. This process also discharges an unnecessary amount of water. A body does not need it. Mucus. Mucus is preventive type of body fluid that excrete from various body parts that the antibodies, proteins and enzymes present in the substance protect your throat, sinus, lungs, mouth, nose from getting dry. The functions of body fluids are The important function of body fluids include the body fluids facilitate transportation of oxygen, nutrients throughout the body and remove waste from the body. They help in regulating body temperature. They maintain an efficient metabolism of the body. The significance of body fluid is firstly is saliva. Salivary gland produces almost 1 liter of fluid per day. Serous and mucus material. Some drugs that can be monitored include digoxin, phenytoin, theophylline, phenobarbital, dexamethasone, benzodiazepine, cocaine, heroin, codeine and nicotine. Drug abuse like alcohol, barbiturates, amphetamine, and marijuana can also be monitored. The hormones like progesterone, 70 alpha hydroxyprogesterone, cortisol, DHEA, androstenone, testosterone can be also measured. Syndrome can be diagnosed by the measuring increased sodium and chloride. Radioactive material is measured for the diagnosis of hydrothyroidism and hypothyroidism. Can disease cystic fibrosis. Can estimate secretory IgA take care of saliva contamination by the fluid due to chewing tobacco. The nasal secretions, it helps to diagnose allergies by showing an increased number of eosinophils. An increased number of polys indicates acute infection. Increased eosinophils and neutrophils indicate infections superimposed on chronic allergy. Can detect RSV by rapid antigen test. It will be differentiate between nasal secretions and CSF in the possible skull fracture. Sputum. The usefulness of sputum culture is controversial. Mostly the sputum is contaminated by upper respiratory tract bacteria. Some contaminants and Staphylococcus aureus, Staphylococcus pneumonia, Haemophilus influenza, enteric gram-negative organism, and Candida. In literature, there is dispute that sputum culture may be find the causative agent. In case a pure growth of organism is found to favor the pathogenic infection. In case of increased squamous cells, favor the contaminated by oropharyngeal mucosa. Squamous epithelial cells is greater than 19 lpf is equal to poor specimen. Squamous epithelial cells 11 to 19 per lpf is equal to fair specimen. Squamous epithelial cells is less than 10 lpf is equal to good specimen. The more squamous epithelial cells are found, the more chances for contamination. Tears may decrease in Sjogren's syndrome, dehydration decrease facial nerve function, and Horner syndrome. Lysosomal disease may be diagnosed by the deficiency of enzymes in the tears. The following diseases are diagnosed: Tay-Sachs disease, fucosidosis, type 2 glycogenesis, Marshcromic leukodystrophy, Fabry disease, Sandoff disease, Monocytosis, Euler and Skelet syndrome. Decreased volume is also seen in the dehydration. Milk are the increased WBCs in the milk that will indicate acute infections is greater than 103 colonies of the bacterial per ml. WBCs greater than 106 indicate infections compared to the non-infectious inflammation or clogged ducts. It is usually due to S. orinus or S. epidermidis. This infection develops in nursing mothers usually 2 to 5 weeks after postpartum. Cerebrospinal fluid. Cerebrospinal fluid may be cause bacterial or viral meningitis. Infants under 1 to 2 months have most common infections by B. streptococci. Children from 3 years to 5 or 6 years have H. influenza, commonest organism, followed by meningococci and pneumococci. Children and older adults have meningitis. The second common organism is pneumococci. In older people, pneumococci are more common than meningococci. CNS syphilis can also be seen and diagnosed through CSF examination. Mycobacterial meningitis is common in children between 6 months and 5 years old. It also seen in elderly patients. Cryptococcal meningitis is the most common fungus producing CNS infection. Other fungi causing CNS infections are Candida blastomyces, histoplasmosis, and Pochydiodamasis. HIV also produces mild aseptic meningitis. Simon, there may be infection by chlamydia or syphilis. The presence of inflammatory cells indicates genitourinary infection. The most common organisms are E. coli. Viruses can also live in the semen like Ebola, HIV, hepatitis, HCV, and herpes. Chronic infections affect the sperm count and lead to infertility. Vaginal secretions. Trichomonas causing vaginitis is quite common. Freshly prepared pap smear sensitivity is 50% to 70%. Bacterial infections of vagina may be due to aerobic and anaerobic organisms. There are maybe infections from G. vaginalis, Mobicillus accompanied lactobacillus. Local causes the may be endocrine, poor hygienic, scabies, pinworms, foreign bodies, and local irritants. There may be infection by N. gonorrhea, chlamydia, streptococcus group A, streptococcus aureus, idiopathic associated with HIV. Synovial fluid. Nearly 1 ml of synovial fluid is aspired for the culture and other studies. Gram-stain reported 40% to 70% of positive septic arthritis. Gram-positive organisms are more common than gram-negative bacteria. Gonococcal infection is the most common cause. Occasionally, synovial RA test positive before the serum lactate is raised in septic arthritis and is greater than 250 mg per dl. Complement is lowered in rheumatoid arthritis and SLE. Sweat. This is important for diagnosis of various diseases. There is a change in electrolytes in cystic fibers. Various diseases have different odor like maple syrup and some drugs. Sweat color is also important in various diseases like brown ochronosis, red in rifampin, and blue in occupational exposure to copper. Stool examination is one of the non-invasive procedures to diagnose various diseases. The stool can be cultured to diagnose bacterial diseases like Salmonella, Shigella, and tuberculosis. A stool examination can be done to diagnose parasitic infections. A stool examination can diagnose viral diseases. Urine. The urinary tract infections, most common organism E. coli. Nitrate test dispositive in UTI. Nitrate negative organism are Enterococci, N. gonorrhea, and M. tuberculosis. Thank you.